Good morning. I'm Laura Levin, reporting live for Public Media Network at the 2012 Holistic Skincare Conference.
Today, I would like to talk again about questions with people asking every morning. And those people are professionals, those people are customers, those people are just old people. When we're looking in the morning in the mirror, we think, oh my goodness, what should I do sometimes? Because sometimes you're waking up and thinking, oh, maybe I should do something more than I do every day. And then questions popping what to do. And today we're here to talk about non-invasive, non-surgical, safe for your health, holistic methods to look better, to look healthier.
I'm here with Alina Fedotova, President and CEO of Alina Organics. How long does it take you to develop these products, and what's the inspiration behind it?
It's my profession. I'm a formulator. I'm still developing my products. Every year I'm developing and bringing new products, and I'm actually adjusting and perfecting my existing formulations. So it's an ongoing project of my lifetime. So longer I am alive, I will keep doing it.
What would you say educationally is the difference between yourself as a cosmetic chemist and a general practice chemist?
You know, I specifically studied the cosmetic formulations, and I studied herbology and aromatherapy. I'm a natural formulator, so additionally to general chemistry, all my education been focused on natural, organic formulations.
I'm here with Jerry Schubert, who is 81 years old. Jerry, what is the secret to your fantastic appearance?
My secret is knowing Alina. I've been going to Alina since she's been in Kalamazoo. And I have to tell you this because I was in the park doing Tai Chi with one of her clients, and she says, I've met the best discovery in Kalamazoo. And I said, who? So she said, Alina. And after our exercising, I went to her studio and made an appointment. And I have been going ever since. And I think that she is a jewel for Kalamazoo. I feel fortunate because I've always done skincare, but I didn't know anybody like Alina. And like I said, I'm 81. I use all of her products, and I feel she does a wonderful job.
With Althera, we can actually treat, one side a little bit more than the other, apply a few more lines to achieve better balance and symmetry of the face. So this is the system. We actually are going to be doing a demonstration with Althera. We actually could not get our cool sculpting unit onto the van to get it down here today, or we would have done a cool sculpting patient as well. But we will be demoing the system out so you can actually see how it works today.
I'm here with Dr. Bradley Bengtson, one of Grand Rapids' best plastic surgeons. Bradley, can you tell me how long you've been in this field?
Hi, Laura. So I've been a plastic surgeon for about 20 years. And I'm from Indiana originally, but came up to Grand Rapids, did my training there. And I did a fellowship at MD Anderson Cancer Center for a year, and then I've been back in Grand Rapids for about 20 years now.
How have people's views changed of plastic surgery?
I think with a lot of the reality shows and those things are out, that's a real double-edged sword. I think it's made plastic surgery a little bit, more open to talk about and those sorts of things. But also it's kind of increased patients' unrealistic expectations about what can really be achieved. So for me, I think the real significant aspect of things is that I only do things that are really restorative to a patient. So really just restorative and natural, proportional sort of results. I don't do anything that is over anything. So I think as long as you kind of treat patients like that, so we're creating a younger you, not a different you. And again, like I said today in the conference, I think the best plastic surgery is in patients you can't tell have had it.
Of course. What does the future of plastic surgery hold?
You know, plastic surgery is probably one of the most rapidly advancing dynamic practices in medicine. There's very little what I do today that I did in my training 20 years ago. So laser technology, a lot of the technologies we spoke about today with Althera, this skin tightening system with ultrasound, and Cool Sculpting fat freezing system, they're very, very new technologies. So they may have been worked on and a lot of the research done maybe 5 years ago, but they're both, just newly into the market. There's upwards of 2 to 3 new technologies a month, coming out in the United States alone. And the United States has a very regulatory market, so it's very difficult to get new devices and procedures approved here. So, but even with that, it's the exciting thing about plastic surgery again is it's kind of mixing and molding all these things together. So it's bringing together, in a very collaborative way, different skincare products like with Alina that we do, kind of mixing and putting those things together with the non-surgical and surgical aspects, I think is really, really cool and exciting.
Sugar is so much fun, isn't it? So the old-time dermatologist, when tetracycline came around, wow, this was a terrific boon because then he didn't have to tell Johnny he couldn't eat his ice cream and cookies and candy and all that. And so it was an emotional relief for the work of the dermatologist. It was much easier. And a lot of people don't want to hear it. They really don't want to hear it. Or they'll hear it, but they'll get around to it when next week or like that. Remove the foods that aggravate. And obviously, if it's something that obviously aggravates, get it out. You may have to look further. Chocolate, fried foods. Now they don't aggravate everybody, but if you want me to cause acne in somebody, I'd like to have chocolate, I'd like to have fried foods, and I'd like to have sugar.
I'm here with Dr. Datner, the founder of Holistic Dermatology. Dr. Datner, how long have you been doing this?
About 33 years.
What would you say would be some advice to give to someone who is thinking about treating their acne with medication?
Well, I think it's important to decide whether you're ready to start making some lifestyle changes first. If the acne is so bad that scarring is about to happen, then that may be appropriate to use the medications. And if you're not willing to make the dietary changes that are necessary, then I think that medications may be an important step to take. But if you're trying to improve your overall health and get long-term control of your acne, then it's really appropriate to take steps to make changes and see if at least you can lower your need for any medication and improve the condition so that you can get off the medications if you're going to go on them in the first place.
What are some necessary steps that we can take to treat our skin naturally?
Well, the first thing is to bring us back to a diet that we were more adapted to eating for centuries and millennia, and that was a diet that lacked refined sugar and various forms of refined sugar, such as the corn syrup that has been infiltrating our food sources more and more because it makes it taste sweet. So getting rid of sugars is a good idea. Going back to eating more vegetables is a very good idea. Avoiding foods that are processed with very high temperature, like fried foods, makes sense. And avoiding other kinds of prepared foods that have a variety of dyes, chemicals, pesticides present in them, preservatives, that may be things that our body isn't so happy with.
Now, you're a holistic dermatologist. How does what you do differ from regular dermatologists?
Well, my focus is on correcting the underlying problems that are leading to the issues that are going on in the skin. And I interface with the methods that a regular dermatologist would use because I'm trained that way when it's necessary, whether it be removing a skin cancer or using an antibiotic when somebody has an infection that we need to control quickly. But I tend to avoid those kinds of treatments using, for instance, antibiotics and steroids when I can do it by working with nutrition, with the body's own defense system, by making changes in the diet, by using supplements to get the different organs of digestion working better, and calming down inflammation in a more gentle way with herbs if that's appropriate. So sometimes I will even use both, but I'll try to pull away the say the topical steroid, which I'm using to get something calmed down, or the topical antibiotic if I have to use that, while I get the body working better so that they don't need to use it.
From the Holistic Skincare Conference, I'm Laura Levin, reporting for Public Media Network.